Dr. Meghani, we have talked a little bit about the treatment that Alabama Clinic does, and first off, I want to get into depression, and then we'll talk about the treatment. Depression is nothing to be ashamed of, is it? If you have depression, it's like having cancer, heart disease, or anything else. It's something you need to seek out professional medical help.
You answered.
So,
Absolutely correct.
so it's the stigma of society sometimes of depression. But what I've seen, what you've seen, it doesn't matter whether you got plenty of money or you're broke. Depression does not really pick its victims. It just happens.
It happens.
Okay.
You are born, you gave the example, out of 10 female, 1 or 2 might have the breast cancer. Now, of course, the family history can increase the chances of the breast cancer, but that does not mean it's 100% penetrance. That person without the family history can have the breast cancer. Or somebody can have a brain tumor, meningioma or glioblastoma, unfortunately. Okay? Depression is nothing different. Albeit, the stigma is something we still, in 2018, dealing with. Hasn't changed much.
But one message I'd like to emphasize is it's not a stigma. Seek out help. And Alabama Clinics, which is located here in Dothan, your life has been devoted to treating people with depression and depression issues, and y'all have a treatment now that seems to be working different than the medications that's been there for years. Tell us about the treatment that y'all Alabama Clinics has been doing.
Okay, so we are going to talk about the IV ketamine. Okay, now first of all, ketamine, when we go online or when we talk with few people, they say, as you said earlier on, veterinarian medication, party drug, and still ketamine is controlled medication. I believe is 4. Okay, so yes, but when we talk about IV ketamine treatment, we are talking about low dose ketamine. It's a totally different concept, different phenomena. Low dose ketamine, and by the time it's infused into the normal saline and given, it's essentially not controlled medication anymore. Okay, so when somebody is getting a treatment, first of all, they need to realize it's not a party drug, it's not a controlled medication they are getting. Okay, so it's very much diluted. Now, back in 1999, it all started at Yale University. That's where the beginning of the story of the IV ketamine was. The doctors at the Yale University, Connecticut, they were doing research on the ketamine low dose and the NMDA receptor, N for Nancy, M for Mary, D for David, A for Apple, NMDA receptors. And naturally brain has several different receptors, serotonin receptor, GABA receptors, NMDA receptor. So the research started back in 1999 at Yale University, and over the period of time other places got involved. John Hopkins, Harvard, other places got involved, and I would say late 90s, early 2000, finally they found out that low dose ketamine works in clinical depression. Someone who is acutely suicidal. When we talk about suicide, we talk about suicidal ideation, suicidal intent, suicidal plan. There are phases. One is somebody is talking about it, one is somebody actually is ready, contemplating, have a gun, have a plan, hanging, ready to do it. Okay, so they tried this IV low dose ketamine over 45 minutes infusion, and what they found was a reversal of the suicidal thoughts, acute. Okay, and that is a change. All these 40 years of treatment that we had in the field of psychiatry, in the field of medicine, antidepressant medicine, mood stabilizer, antipsychotics, okay, we have not seen a change or decrease in the suicidal, the incidence. It has been same. So the medicine really has not made any difference. This is the very first thing, in addition to, of course, the shock treatment, which we call as the ECT, okay, which actually can reverse the suicidal thought, help the neurovegetative symptoms of severe depression, sleep, appetite, loss of interest, no energy, no motivation, no drive, no concentration, essentially miserable life, so much so that you apply for disability. Of course, depression, just like you said about diabetes, somebody get diabetes, eventually they get the neuropathy or renal failure or blindness, and they get disabled. Depression is no more distinct. People get disability, and I've seen it. I'm one of the psychiatrists. Of course, the place has a lot of great psychiatrists. So we all have seen the misery associated with depression, or depression as a part of the bipolar mood disorder, or depression a part of the schizophrenia, or depression a part of the drug addiction. Maybe they are sober, but all these years of drug has affected their brain, and now they are clinically what we call as melancholic depression. So IV ketamine, one that started, the journey started at the Yale University in 1999, and now there's, abundance of literature. So all this myth about it's a veterinary medicine, it's a party drugs, it's a, while they hold true to some extent, but when it comes to IV ketamine, the new story which has been unfolding now is totally different. Okay, what I can tell you about some of the